10 Unhealthy Characteristics of a Dysfunctional Family. The characteristics of a dysfunctional family vary from family to family, but unhealthy families may exhibit one or more of these common characteristics. When left unexamined and unresolved, these family traits can pass from generation to generation. Poor or ineffective communication. Members of dysfunctional families have a hard time listening to each other and expressing feelings in appropriate ways. Family member comparisons. Parents who expect all their kids to follow the same life path create issues when they compare each child to another in the family. These comparisons can be blatant, like having more pictures of one child hung around the house, or subtle, like comparison comments. Power struggles. When one family member tries to control all others or multiple family members vie for control, this creates dysfunction. Those who feel controlled may subsequently experience self-esteem issues, symptoms of depression, anxiety, as well as trauma-related disorders, and have difficulty regulating their own emotions. Excessive criticism is considered a form of verbal abuse. Criticism can be subtle, such as constant teasing about looks or behaviors, or it can include direct comments meant as put-downs. Unpredictable interactions. Not knowing whether you'll have breakfast today or wondering whether dad will come home and start fighting with everyone can cause a lot of emotional trauma for kids when they are young and as they grow. Conditions for care. Unconditional love may not be present in some dysfunctional families. For example, a mother may only show love towards her kids when they do things for her or get straight A's. When a family member puts conditions on when they will love others, it can lead to an unhealthy self-esteem, feeling unlovable, having symptoms of anxiety, depression, and trauma-related disorders, as well as experiencing difficulty with trust. Little to no intimacy. Intimacy within a relationship means having a deep, meaningful, and mutually trusting connection with another person. In families with dysfunctional traits, unhealthy relationship structures, such as codependent and parentified parent-child relationships, may be mistaken for true intimacy. Drug or alcohol abuse. Those who have experienced previous or ongoing trauma are more likely to use drugs and/or alcohol. A parent or caregiver who is actively using is unable to create a safe, loving and stable environment for their family. Lack of empathy. In families with dysfunctional traits, many, and sometimes all members, have a difficult time with insight. When empathy is lacking, other family members may feel misunderstood, bulldozed, rejected, and criticized for having genuine feelings or reactions to a situation. Excessive expectations. Excessive expectations, or perfectionism, is when a family member's expectations of you are wildly unrealistic or put intense demands on you. Causes of family dysfunction. Feeling like your family hates you or feeling like you hate your family can contribute to the family dysfunction. Untreated mental health issues, unhealthy parenting patterns, unhealthy attachment patterns, lack of support or resources, individual internal struggles, financial problems, chronic illness, behavior issues, alcoholism. Always watch out for yourself and seek help if you feel overwhelmed. There is no shame in asking for help. Peace of mind first.